Hi there, I'm Lily Hill, and today I'd like to present to you on the topic of polypharmacy, or as I like to say, false comfort in a challenging time. Our whole world population is aging. I am aging, my children are aging, and you are aging. As you age, are you thinking about how you can age well? What does aging well even mean? To me, aging well is maintaining my quality of life across my health span as I maintain my activities of daily living. I want to retain both my physical abilities as well as my cognition. This brings me to discussing one topic that can affect how you think, your memory, and can change your quality of life. That topic is polypharmacy and aging. Alongside polypharmacy are concerns about adverse drug reactions, changes to physiology, changes to pharmacodynamics, and changes within the brain. I'll conclude this presentation by discussing what we can do about polypharmacy. So what is polypharmacy? After first recorded use in 1762, Merriam-Webster Dictionary defines polypharmacy as the practice of administering many different medications, especially concurrently, for the treatment of the same disease. Polypharmacy is also used to describe the concurrent use of multiple medications by a patient to treat usually coexisting conditions, and which may result in adverse drug interactions. All that to say that polypharmacy is taking multiple medications for the same problem or multiple problems, where the medications could cause more problems when taken together. So think about your own medication use. Count how many medications you currently take. Is it more than 5? More than 10? In an article from Saljo Gayan, the author writes that among adults aged 65 or older, 44% of men and 57% of women take 5 or more medications per week, with 12% of that same age group taking 10 or more prescriptions and or non-prescription medications. Have you ever thought about how each medication you take interacts with the others? Have you considered how each medication is affected by food, or how your own body processes the medications that you take? What about taking medications with supplements? On the topic of drug-drug interactions, when we discuss polypharmacy, adverse drug reactions lead to about 9% of the hospitalizations of older adults each year and occur at a frequency of about 10 to 35% among community-dwelling older adults each year. Picture it. Nearly 1 in 10 of the hospitalizations of older adults can be contributed to adverse drug reactions and affects about 1 to 3 out of 10 older adults that are still living at home. Did you know that as you age, your physiology changes as well? Don't panic, it's totally normal. Healthcare providers anticipate it, and we dose adjust medications to account for those changes. As your physiology changes, you can experience body composition changes, such as increased body fat, decreases in body water and lean body mass, decreased response to stress, decreased balance, decreased vitamin absorption, increased bladder hyperactivity, decreased hormone levels, decreased kidney and liver function, decreased senses of taste, smell, hearing, vision, and thinning of hair and skin. You can also experience changes along with these that affect how your body processes medications. There are these pharmacodynamic changes, such as changes to your stomach and intestines, that can affect how your body absorbs medication, meaning some medicines can be stronger at smaller doses, while others may be weaker at even larger doses. Changes in how your body distributes medications can be a big concern too, as body composition changes. For example, if a medication is water-soluble, as total body water decreases with aging, now that medication is not getting where it needs to in your body the way that it used to. And if a medication is fat-soluble and your percentage of body fat has gone up, a dose that used to be okay when you were younger could now be toxic if not adjusted. Changes in your liver can also affect how you metabolize medication. You might have a medication that's normally cleared by the liver, and now it's not being removed and is building up in your body instead of being removed in your feces. Changes to your kidneys can affect how medications are removed in urine. If your kidneys are not working as they used to, say with lowered blood flow due to an increased aging-related blood vessel damage or decreased heart function, to move the blood through your body, then you could again have medications that are hanging around longer than they should. And again, we're worried about toxicity with a normal dose. All of these concerns are significantly more complex under the lens of polypharmacy. There are age-related changes to brain size and weight as well. And those changes can also occur with the system of neurotransmission. As we age, changes occur that decrease the number of receptors. There is also a change that tries to make your remaining neuroreceptors more sensitive. When these changes occur, older adults become more sensitive to the effects of classes of drugs that act on our brains, such as anticholinergics, antipsychotics, benzodiazepines, anesthesia, and opioids. And that means that your allergy medications, pain medications, and even something like anesthesia, if you need to have a surgical procedure, can all suddenly become stronger to you as you age. So what can we do? What can we do to reduce the polypharmacy and minimize our risks with aging? Taking actions early as possible for physical activity, nutrition, quitting smoking, limiting alcohol, exercising your brain with puzzles, getting together with friends, managing hypertension, diabetes, keeping a healthy weight, and getting help for depression, and also getting help for hearing loss are the most helpful actions that we can undertake according to the World Health Organization. Doing all we can from that list, we can minimize polypharmacy as we prolong our health span and maintain our activities of daily living. Cognitive decline certainly is impacted by polypharmacy. Having a healthcare team that is both knowledgeable and motivated to oversee our medication therapy management while involving each of us as patients who are supported and encouraged throughout the process is the best way to limit polypharmacy and have better health as we age. In conclusion, today we've discussed polypharmacy and clarified that while it sounds like it's a quick fix to problems, it can complicate healthcare in aging. We discussed adverse drug reactions, changes to physiology, changes to how your body uses medications, and changes in your brain. And we discussed what we can do to prevent polypharmacy and how we can avoid the problems of polypharmacy. Thank you for your interest in this fascinating topic, and I look forward to answering questions that you may have. Here is my contact information. Please feel free to reach out to me by email. Here is my list of resources. Thank you again for paying attention today.